Hi, I'm Cristina. Today I'm going to do a sterile technique wound change, dry it down. So first I'm going to tell you my 7 steps. I'm going to check the doctor's order, identify the patient, identify myself, gather my equipment, wash my hands, tell the patient what I'm going to be doing, and provide for privacy. So first I'm going to set up my sterile field. I have my towel drip. I'm going to open it. I'm going to grab it by the corner, let it just open by itself. Grab the other corner, put it down. So I'm going to use this as my waste basket, but I probably have some pail over here. Alright, so now I'm going to open my gauze. Open it and drop it right to the center. I'm going to open my ABD padding, make sure it drops right to the center. Open up my sterile bowl. Drop it. Then I'm going to put some of the sodium chloride into the bowl, but first I'm going to check to make sure it's not expired, and if it's not open I'm going to label it, make sure that it's labeled that it'll expire in 24 hours. So if it was opened, I'm going to cover the label, pour a little bit out of it, and then pour it in. So after that's done, I'm going to put on my clean gloves. And I'm going to take the dressing off the wound. Make sure I do it very gently, just in case there's a drain in there. There's no drain, so I'm going to take it off, put it in the waste basket. And I'm going to gently take that out. Then I'm going to assess the wound. I'm going to measure, make sure if there's any inflammation or if it needs to be cleaned. I would do that now by taking gauze and going from clean to dirty and throwing it out. Then I would document everything at the end of what it is. Then I would take off my gloves. And now I'm going to put on my sterile gloves. Make sure this is out of the way. So, this. Okay, and then I'm going to make sure I go from the inside out. Okay, then I'm going to put the glove on my dominant hand first. And I'm going to take the glove from the inside. Make sure that this is inside. And then I would fix my gloves. Okay, now that I have my gloves on, I'm going to make sure that my hands stay in eye level above my waist. So now I'm going to take the gauze and wet it, and then I'm going to take this hand, wet it, switch to this hand, and I'm going to take my pad, put it right over it. And now it is sterile. And I would take my tape to make sure I tape it with paper tape so the patient doesn't get irritated. Make sure the patient is covered. Make sure all this is thrown out. And then I would document everything and wash my hands.